When we're thinking about fading their fear, I've mentioned this concept of shaping. In animal training, we typically talk about shaping to mean the use of multiple steps to get to our ultimate goal. So the ladder on the left is much easier to climb than the ladder on the right. And if we make a mistake on the ladder on the left and we slip backwards, we're going to slip back less far than if we were climbing the ladder on the right. So when we're thinking about applying that principle within a consultation, handling, treatment setting, our first thought should be, what state's this patient in right now? So is the patient already calm and relaxed? No. And how do we recognize that? Well, we're using that FAS scoring system and we are at a 3 or above. So 3 is well into the amber range, of course, and beyond that, 4, 5, 6 into the red. Well, if we're recognizing that, stop. Why is the patient not calm and relaxed? And back to that earlier slide, is this an in the moment thing because it's new for them? So we could actually break it down into smaller parts. Or is this because of previous associations, previous learning that they've had, which might have happened in the clinic or may have happened in other husbandry or unfamiliar people, unfamiliar dog experiences for them? Is it because actually this dog is in pain right now with their ear infection, their wound, post-operatively or whatever it may be? If the patient is calm and relaxed, so we're giving them a score of 0, 1, or 2, then great. Let's proceed with a calm shaped approach. What is our aim? Our aim is to perhaps take a blood sample, or it's to give an injection, or it's to complete a part of a specific examination. Well, let's break that down into lots of little steps. Let's do a little bit of the examination and just pause, and then perhaps give them a treat or give them a fuss somewhere else, and then go back to further along in that examination. Have we got them prepared for the injection, as an example? Have we got them used to just being touched on the back of the neck? Pair it with something nice. Holding the skin on the back of the neck, giving them something nice. Doing something else for a few seconds, and then allowing them to see the syringe, just placing the syringe on the back of the neck, giving them something nice, and then giving the injection. So several steps along the way rather than just, I'm going to give the injection straight up. And we should, of course, during that time, be using that FAS scale to observe the body language and actions of the dog. If we're seeing the dog shifting up that scale, so they're starting to get a little bit higher on their scores, put in a few more pauses, give them a little bit more time, give them a little bit more reassurance, encourage their human to give them a little bit more reassurance. And of course, if they're dropping down then a score, then that hopefully is a green amber light to continue, but continue monitoring. Use reassurance, verbal, physical, benefit from having that human caregiver present, give positive reinforcement, give something nice. And if we do that and we'll take those breathers for observation and allow the dog to sometimes make movement, things will almost always go much better. If, despite that, we are still seeing an increasing stress score, well, then we're back over here. Stop. Think about why. What's our better plan? So, what is our plan? Can we stop for a bit longer? Perhaps if they were on the table, let's get them off the table, go on the floor and let them do something else for, 30 seconds, a minute or two. Maybe change rooms. Maybe let's go outside and continue some of this examination in a different part of the clinic or even outside in the car park where they can be having a sniff and they don't feel so hemmed in. Can we, after that pause, represent what we were trying to do in smaller steps? They really didn't feel comfortable with the clippers. So, okay, we've given them some time on the floor. They've had a few treats. Can I just turn the clippers on wrapped in a small towel to make it a softer sound? And then give them a treat. And then have that a bit closer to them. Give them a treat or a scratch or an interaction with their caregiver. And then can I hold it against their neck so they just feel the vibration? Then can I move it up and down? Have another pause. Can I now have it out of the towel and have it a little distance away, etc., etc. So that's the sort of thing where we'd be thinking about better shaping of something. And where possible, pair each step with a positive outcome. It might be a lick of something tasty. It might be a scratch on somewhere that we know they actually enjoy being touched. It might be a little bit more interaction with their human caregiver. If we think it could be related to pain, can we change positioning? So perhaps the dog would be more comfortable on the floor. Are they on a yoga mat? What's the slipperiness of the floor like? Would they prefer to lie down on a slightly padded surface? Do we even need to take a break to administer pain relief? Do we need to complete this now? Or could we give them pain relief today and get them to come back later? Or give them pain relief now and then slot them further in, in the consult sessions later if the client's got time to then go for a drive or whatever it may be? Can we use positive and safe distraction? And I'll come back to some thoughts on that in a moment. If those sorts of things don't seem realistic because of the stress level of the dog, or we're attempting them and they're not working, how urgent is this? Can we delay this and replan? Perhaps we want to think about anti-anxiety medication with or without pain relief if the pain might be an issue for them given prior to that next appointment. If it is urgent, because this is a wound that needs addressing, it's an infection, it needs clipping and cleaning, or surgical attention, or the blood sample is very important, should we be thinking about sedating or anaesthetizing the animal before things escalate too far? Because, of course, once that patient is significantly adrenalized, then things are going to become much harder. We all know there's a lot of pressure to get a procedure done once we as the vet, the dog and the human are in place. As I said right at the beginning, owners themselves might not want to pay for a repeat visit. They might not want to leave the dog in the clinic for a whole variety of reasons, including possible transportation issues and what else is going on in their lives. So we need to empathise with the client and we need to empathise with ourselves, understanding our own time pressures and diaries. But we have to find a way to be an advocate for the dog's emotional well-being, as well as just considering their physical welfare. Because at the end of the day, if we end up with a dog who is very stressed, then the outcomes of what we are going to do are likely to be poorer. We may find the dog doesn't sedate or anaesthetize well. They have a more rough sedation or anaesthetic. Maybe everything manages this time, but the next time the dog comes into the clinic, we can't touch them at all. And so being aware of those outcomes hopefully helps us to be more confident in our pauses, our reassessments, and involving the human caregiver with that plan. There's a whole host of techniques that we can use to make things better for dogs visiting the practice, both with tolerant individuals and for those less tolerant. We can get them used to things in advance, and that's some of the stuff that we've got on the webpage to take a look at. We can think about emotionally responsive cooperative handling practice. Again, we've got some thoughts about on that webpage. The pet remedy odour can actually be useful for that too, not only for its potential pharmacological, physiological effects, but also as a predictor odour. And we've got some videos that will be available through that web page. So if at home we've got the dog familiar with the odour from a distance and it's on a, let's say, stripy beach towel, and now when we get that scented beach towel out, the caregiver does some massage with their dog because their dog loves that. They do some gentle play or lick mat or forage mats, gentle treat search because their dog is calm but very positive about that. So that's what we mean by that predictor odour. And then using that as an odour that we're going to do something, but actually it's going to be positive and we are going to respond to your communications can be a really, really powerful tool. So those emotionally responsive interactions, again, a lot of this stuff is what we can be doing away from the veterinary practice, what we can educate or provide education for caregivers to learn to do. And, we have resources available for this stuff on that webpage. Observe and respond. So the dog keeps that conversation in a whisper to a normal talking volume. By feeling emotionally responded to, I can communicate safely. I am being listened and responded to. We build a huge sense of safety for the dog. And if we build that sense of safety and the dog feels they have more control over the situation, I have choices because I know if I offer this, then they're more likely to pause and respond to me. That makes things far safer and significantly improves the emotional well-being of the dog in the practice. Because of that, we're less likely to get higher stress scores, and we're less likely to get behaviours of concern. In a piece of work by Quaronta a few years ago, they highlighted how dogs can link odours to memories, so that when they then smell that odour again in the future, it can influence the behaviours they offer in the presence of that odour. And this is why I was just mentioning about the potential for pet remedy, not for just its pharmacological, physiological impact within the dog, but also as a associated odour as a smell. Associating a unique odour with calm, positive outcomes started at home is a really useful transference to something that we can do in the clinic when we're trying to create a fresh start, particularly for individuals who have had previous negative associations at the vets. So more on that on the emotional well-being page. We've talked about low stress setups in about the approach to the dog arriving at the clinic, the approach within the consult room, etc. We've talked about graded touch. We can also think about using predictor cues. So these can be helpful as well. So the dog knows we're going to do something. So we might give a verbal cue or a hand signal or both combined together. Like me touch is something I might say, or vet touch, which I do that and give a hand signal, and that means I'm going to touch you now, and then it's going to still be shaped. It's going to be gentle touch, positive touch with a positive outcome. And then each time I'm going to do a touch-based interaction, I can give that signal. I can do something for a number of seconds. They know that that's what's going to happen. They know there should be a positive outcome at the end of it, and it can really improve the predictability for the dog and make them feel a lot better. We talked about the concept of restabilize rather than restrain, and ideally, where possible, do as much on the floor rather than on a table so dogs have greater choices. Or what I sometimes do for my smaller patients is put two tables together. So I'm quite commonly moving one consult table from one consult room into another, and then covering it with some sort of blanket or yoga mat. So the dog has actually got a little bit more space if we do feel they need to be elevated off the floor for some reason. Sometimes we can do things like a home taught trick. If a dog has learnt to give paw at home, if they've learnt to turn around at home, if they've learnt to play dead even at home, some sort of trick. Knowing that if they offer something, that they know how to do it, and that at home gives them a positive outcome, promotes a concept of improved control for the dog and can often make them feel a lot better. So when they first come into the room, I might give them a few minutes while I'm talking to their caregiver, and then I might say to them, okay, why don't you ask them if they want to do, something that you often do at home? And the dog goes, oh, cool, I can do this. I know how to do this. I know what the outcome can be. This should always happen on the background of meeting their needs well at home, having good positive social support at home, positive experiences at home, good sleep patterns, all of those things, because all those things support resilience. It means that the dog is going to be able to cope with these stresses more effectively. A piece of work that was done back in the 1960s, and I credit these images to Jenny Nyberg, who has done a lot of academic research on these intense stress responses in dogs through the University of Gothenburg. And so she kindly lent me her images for this. That in the 60s, we found that, where dogs were given the option to learn how to press a button to switch off a potential shock or an actual shock versus dogs who weren't given that opportunity. So they didn't develop the skill set of knowing they could do something to switch off a negative experience. We ended up with the dogs who had previously learnt that they could switch off something negative, even when they couldn't in that moment, they coped much better. The individuals in the groups who had not had the opportunity to learn, I can have control over certain negative experiences, didn't cope well at all. So one of the background things which we can provide information to clients about in practical ways through the emotional wellbeing page is that you can build in this concept of dogs having control over certain circumstances, and the more control they often have at home and in certain setups, when that control isn't available for them, they still will cope better than dogs who aren't being given that opportunity. So we can apply all of those things I've just gone through to intolerant individuals as well. But when we're thinking about a dog who is really struggling in the clinic, we need to add in some extra things. We can add in more active use of distractions. We might need to think about strategic plans at home that help counter condition or extinguish previous negative associations. And we might be wanting to think about the use of fear-reducing medications. So positive distractions, as I've mentioned already, the aim of positive distraction is that the patient doesn't notice or barely notices the procedure. Because actually, if we're going to put a needle into a dog, if we're going to listen to their heart with a stethoscope, if we're going to take their temperature with a thermometer, and we know those things are going to be unpleasant to the individual, then if they don't even notice we've done them, it's always going to be preferable. This works well for procedures that are short, could be nail clip, could be blood samples, might be thermometer, temperature taking, probably certain types of injections, but of course doesn't work as well if we have to keep them distracted for a much longer period of time. But I often say what we're trying to do really is fill their current awareness with something super positive. Now, I've used the icon image here of cheese. For some dogs, cheese might be appropriate. And when I say cheese, I'm talking about, perhaps Primula, some sort of squeezy cheese. It could be some other meat flavored paste, something that's really tasty, valuable, but it's only a small amount. So it's licking that off something or being given really tiny, tiny amounts of it. Ideally, that they're really looking for, that they're concentrating on. If you give a dog a piece of cheese and they put it in their mouth and then you put in the needle, they're of course going to be like, well, I've got the cheese in my mouth, but what are you doing? If you get the caregiver or the staff member to have the little pieces of cheese in their fingers, and where is the cheese? Can you get a little piece? Come on, find a little bit more. And they're busy hunting for the cheese when we put in the needle, then they are less likely to notice. Filling up their current awareness with cheese, whatever cheese is for that dog, can work really, really well in order to get a job done. When it doesn't work well is when the thing we're trying to distract them from is too intense. So it might be that they've got a really sore area that we're trying to clip and clean, and it's just never going to be possible to distract them from that discomfort. Maybe it is because we're putting in a particularly large needle, such as re-microchipping them as an example. If they have previously learnt about this stimulus and they've already begun an antecedent response before we attempt distraction. So, because they have had previous blood samples and they know the reliable predictors are arriving, having not been fed in the morning, and then hearing the clippers, then bringing in the distraction isn't going to be able to distract their brain because it's already recalled that memory really clearly. So, an example may well be dog arrives at the practice, they come into the consult room, we lift them up onto the table. For them, they have already learnt that a member of staff holding a stethoscope whilst they're on the table is a predictor for the thing that follows. If the thing that follows is an injection, well, we haven't even got to the point of lifting up the syringe or touching the back of the neck. They're already tense, freezing, maybe growling. So if we try to bring in the cheese, the paste, the distraction after we've lifted them onto the table and picked up the stethoscope, it's not going to work. And of course, there is that potential at that point that then the cheese itself becomes a reliable predictor of the scary thing happening. And so we always want to check in. Are you engaged with this distraction? If I just put my hand on you where I'm going to do the injection or where I'm going to do the bandage change or where I'm going to touch a particular area, do you remain engaged with that thing? That's my best starting place, really, because if they're engaged with the distraction and I put my hand on them and they stop, then it probably isn't going to work. And actually, I don't want to attempt positive distraction in that case because I don't want to poison my positive distraction for future use. Okay. Obviously, always check in with some clients as well. Obviously, over the years, I've met many dogs who, if we put tasty paste on a licky mat or in a bowl or in our fingers, they actually guard that item because that's a history they have outside the consult room. That's not going to help us either. So is the dog normally relaxed with you touching them if they're eating or licking or, engaging with a toy? Yes, then we can check. Okay, well, we're doing that now. If I just touch them in that area, are they still okay? They're still engaged. Then, I'm probably going to be okay to continue as long as I continue making appropriate observations along the way. This is a dog having such a distraction. This dog, when I first met him, was really, really anxious about injections to the point where we couldn't do the injections anymore. But because of his anxiety, he would grab. He was one of those snatchy, grabby Labradors for food because of his anxiety. And so, what we did with him was I would put this licky mat inside. It's a suction licky mat that suctions to the ceramic bowl, because otherwise, if I put it onto a surface and he could rip the edge, he would just rip the edge of the licky mat and try and swallow the whole mat, which is obviously incredibly dangerous and not a positive distractor. Whereas here you can see that by putting it in that bowl, he was, really fully engaged with that. And it wasn't the first time we'd done the bowl thing with him, so I knew that he was going to be okay. So there was minimal check-in, but as you can see, he didn't even notice. And actually that dog went on to have another year's worth of regular injections without even noticing that. And actually each month that he came in, he was calmer and calmer because he knew when he came in, it was going to be a calm, licky mat experience. And that worked incredibly well. Some dogs won't take food, as we've said. So this is a dog where when I first met him, he had developed a real strong negative association with the vets, and he actually launched himself at my head the first time I met him, really barking and lunging intensely. And despite being a Labrador, still will not take food in the veterinary clinic. But what he does love is a ball. And so outside the practice, a couple of times we had some meetups where I'd just roll the ball for him or gently toss it to him to catch. And we just built up a relationship purely based on some play. And so don't underestimate the power of play. In fact, sometimes play can be almost better than food because the dog's more actively engaged if they're interacting with an item rather than just swallowing and not thinking about it. Now, this was in the summer, so the dog is panting a little bit in between because it was actually quite hot when I filmed this. But here we can see that by interacting with the toy and him thinking about the toy, looking at the toy, I'm able to carry out parts of the examination. And this dog now can have procedures done to him, including injections, and he doesn't even need these distractions. But we keep them in there, we keep him positively engaged, we keep shaping, we keep observing, because he has those memories and he can always fall back on them if something goes wrong. So we want to keep everything positive, and and yet, despite all that, he still doesn't want food when he comes in, but he's very keen to interact, engage with play and toys. So it's important that we're aware of that. On the platform, the resource platform for ourselves and for caregivers, there will be some more information about blocking. I'm not going to go into that in more detail here, but basically blocking is, rather than in the moment distraction, we create a set piece of learning that the brain is able to recall, which stops other learning taking place. So if I know that you giving a hand signal means you'll touch me, but immediately there's going to be something wonderful, and we really establish that piece of learning, then we can give that signal and then they don't even notice the injection being given. So overall, this type of procedure can sometimes be more effective than positive distraction because the dog is more engaged with the procedure. So this is a video clip of a dog who had become very aggressive and impossible to handle at their veterinary practice, meeting me at a neutral location where I'd met the dog on 2 previous occasions, just practice, and we had practiced this blocking. So I give a signal of a verbal thing of vet touch, where I tap my own chest as well so they can see and hear me. And he knows that means I'm going to give him a stroke and then give him a treat. And then because we've done that, here I'm actually giving him his vaccination in a dog that was previously unhandleable in any way at the vets and certainly wouldn't tolerate any level of injection. Having given the injection, I'm just going to do a couple of practices of I'll touch you again, maybe touch you with a syringe, using the same thing. I've got my signal, vet touch, then I touch you, and that immediately means there's going to be something positive. And it means we've got a procedure done. The dog was relatively positively engaged, and now we can do some other positive stuff afterwards. Now, in this particular situation, we've done it away from the vets because the vet context was so strong for him. We couldn't even get this dog in the door of a veterinary practice. So this is just showing with this same dog that he's come into a different veterinary practice just for a one-off visit to see if he still feels that he can do the same thing. So he's been in the room, done a bit of exploring before this video clip. But this video clip is then me saying to him, okay, if I give the same signal and I touch you, there's going to be a positive outcome. Now there's a little bit of a freeze and his ears are drawn back a little bit. You can see that there. So I'm giving him a moment to think about it and I'm watching him. For me, it's an amber. And so actually, okay, we've done a couple. I'm going to stop there on this particular occasion. I gave him another 5 minutes or so. And then we had another little practice. And it's just those little stillness moments that just increased in tension. Okay, well, Amber, we're probably okay, but we don't want that to escalate. So we're going to cut it short. We're going to keep it positive, and we're hoping that we can blend that over a few more sessions back towards him remaining more in the green in the actual veterinary context. But bearing in mind this is a dog we couldn't get into practice, who was lunging and biting, who was untouchable. He's done extremely well and literally over only a few sessions. So when we think about that type of approach, we do need to keep asking ourselves, can we ever truly teach cooperation? There was a study done in 2023 that looked at this. It was a small study and they did some cooperative care training for one group of dogs and didn't for others. And they actually found that the compliance of the dogs for those that had the cooperative care training was reduced compared to those that didn't receive it. And that was really concerning and disappointing, of course. However, there were some perhaps quite obvious reasons why that might have occurred. One reason can be that we might find for some individuals, these intolerant individuals who are struggling the most, that when we give them more agency and we give them more choice, we might end up seeing greater attempts at moving away or greater attempts at using distance increasing behaviors than just going still. And that's something that we need to recognize and we need to work through, because the well-being of the patient who is trying to move away, who is trying to communicate, is still better than the dog who's giving up, even though for us in clinical practice it doesn't feel very helpful, but it is something that we can work through if we do it in the right way. What was an issue was that in the study, when it came to actually having the vet visit that they'd done the cooperative care training for, a lot of the owners during the vet visit didn't step in and do the procedures that they'd practiced in the cooperative care training. So they didn't step in and say, okay, let's give a signal, let's give a treat. They just let the exam go on ahead as if they hadn't done the cooperative care training in the background. And of course, that might happen if we ourselves, as the clinicians, aren't open to having the caregiver more actively involved, having the caregiver give a signal and perhaps them give them the treats. So engagement and collaboration with behaviourists, with the caregivers and ourselves is going to be important for some individuals, for some of our patients. And again, there's going to be more information on the emotional wellbeing page about that. Some dogs perhaps have motivational conflict. So they've done this cooperative care training at home. It should feel like it's positive. But if we've not practiced that in the vet context itself, which is what I was just showing you I was doing with that dog a moment ago, the black dog on the previous video. If we don't do that, then when they're in that context, they might think, oh, hang on, we haven't done anything positive here. Is it going to be the same as at home, or is it going to be the same as it was before? And that motivational conflict can exacerbate emotional responses and stress responses in some. So it's really important that we are making quality observations about how that individual is feeling and how well this is going, and tailor plans to those individuals. The whole concept of cooperative care training and how to use that effectively continues to need further research in veterinary practice. Because at the end of the day, our clinic and our examination process is often a reliable predictor of negative things for dogs, whether that be restraint or pain or just be something else that is scary. And so we've got to keep thinking about, well, how can we make kind of the piggy bank balance more positive than more frequently negative within the clinic setting. This was also something discovered by Stellato and colleagues a few years ago in a 4-week specific training program for dogs. It wasn't really as much cooperative care. It was counter conditioning. I'll touch, you have a treat. There's a stethoscope, have a treat, rather than the dog kind of participating. But they found only minor positive improvements for a 4-week program carried out at home. And again, in that specific study, one of the things they include in their discussion is the fact that they did all the training at home. They didn't then carry it into the veterinary context. So if caregivers are doing work like this at home, they are going to need to come into the actual practice where it smells like a vet's, it looks like a vet's, it actually is the vet's, so that they can actually realize, okay, we can do this stuff in this context as well. Okay. The need to build trust with our patients alongside improving their agency and resilience at home can't be undervalued. It's not as straightforward as just come into the practice a few times and have a cookie. It is about developing emotional responsiveness and empathetic and responsive handling, as well as them feeling that that's not just in the veterinary situation, that is something that's increasing within the whole of their lived experience outside the practice. And then just lastly, I've put a couple of slides together about pre-appointment medications. It's a bigger topic in its own right, and hopefully it's something that we'll upload a presentation for on the website in due course. But this just provides you with some references. We can use medications before appointments that have impact on GABA receptors, which are likely to reduce the fear experience for dogs. We can also use medications that work on the sympathetic nervous system, so things like alpha-2 agonists like dexmedetomidine, and we can use combinations as well. It's worth just bearing in mind, as Erickson pointed out in relation to pre-appointment medications for dogs and cats in clinical practice in 2021, that trazodone on its own isn't really considered a first-line anti-anxiety medication. Trazodone in humans often causes more moderate sedation and hypnotic effects, but doesn't necessarily act as a great fear-reducing medicine. So if we do use trazodone, it probably is best to use it in combination. At the bottom, where I've written combinations, the middle line, GABA agonist, gabapentin at around 20 milligrams per kilo and trazodone at around 5 milligrams per kilo is something which is anecdotally being used more commonly nowadays, and something that was highlighted by Love in an online article in 2019. They're the typical figures that I would use for a lot of my patients. But all these products have their pros and cons. And so obviously being familiar with the dog's medical history and also any previous experience they've had when we've given these medications is really, really invaluable. They need to be given at home before the appointment to have their best effect. If we've done that thing where we've paused the consultation or the procedure because of increasing stress, giving them at that time is often not as effective because of the state of the sympathetic nervous system. So if we are going to use them, it's probably best to stop for today, make a plan for a separate occasion, the dog to have the medication and come in on a separate day. I've put together this table, which you can have access to, much of which the content is replicated in the reference from Learn and Landsberg from 2023. But it gives an idea of the time to effect, because the different anti-anxiety medications will take different amounts of time to work, and that's something that needs to be considered. So what's our summary? Our summary is that many hands-on procedures, particularly those that we're doing in veterinary practice, are uncomfortable physically, but also emotionally for dogs. Many hands-on procedures result in the formation of memories, those learnt or conditioned responses, and that can lead to the dog's brain searching for reliable predictors, where those predictors then become the trigger for the stress response that was evoked by the original procedure. I had a painful injection. What predicted that? Because if what predicted that was having this thing placed against my chest wall, or being lifted onto a table, or having the scruff of my neck lifted up, then the brain is saying, well, when you detect that particular stimulus, react then. Don't wait till the actual negative occurs. Dogs will be more comfortable physically and emotionally if they're given time to use body language and actions to demonstrate the way they feel. Time makes us feel nervous because we're already busy, but I carry out my consultations in 15-minute sessions, just like the rest of my colleagues, and I don't find it takes me longer for the vast majority, even of my tricky patients, to carry out the examination and the procedure than other colleagues who sometimes aren't using that approach. So it's just thinking about the time frame and just allowing the dog to feel that there are options and that they are being responded to when they communicate. If we can improve the sense of control and agency they have, both inside the clinic setting and practiced away from the clinic, then that does reduce the dog's need to escalate into those more unsafe, distance increasing actions. Finding ways before arrival, on arrival, and during the procedure to minimize stress significantly improves the chances of the procedure being completed, as well as improving the welfare of the animal in the moment, and arguably meaning that if we're doing testing, that we get better test results as well. Feeling confident about when to stop a procedure in the interest of the dog's welfare and in the interest of potential future learning, because we don't want things to get worse going forward, helps us intervene at the right time. And if we can postpone a procedure to effect a more appropriate plan for another day, everything should go an awful lot better. We do need to help the client appreciate why we're making that suggestion, that it is in their dog's longer term best interests. The use of fear reducing medicines should not be considered a last chance solution. If we use them earlier in a dog's veterinary experience, then we can avoid the development of strong memories that often result in those unsafe behaviours, and we can reduce the likelihood of effective husbandry veterinary procedures actually being completed in a more productive way, which also includes the experience of their human caregiver feeling more positive and taking more positive approach to our entire treatment plan and the whole procedure. That's my Facebook page. If you are interested in getting in touch, or if you've got any specific questions, you're also very welcome after you've listened to the presentation to send me an email at understandanimals@hotmail.co.uk. There are all the references listed after the presentation. I want to say a huge thank you to Pet Remedy for giving me this opportunity, this platform to discuss this. And also for investing time to help us as vets in practice improve the emotional well-being experience for dogs in their medical interventions and journeys. Because I think, there are plenty of practical things that we can do to make the experience not just better for the dogs, but also for ourselves and our own emotional and mental well-being too. So thanks very much, Pet Remedy, and thanks to you for investing the time in listening.